Yeah, no, I fully agree with everything that our colleagues have brought up. If I were to add to that list, I would probably riff a little bit on what Eva would say and say, I know we don't talk about money, but I know that the VA is very concerned about value and making sure that the activities that the VA invests in is optimizing value. And in many senses, I think about McKinsey released a recent report on productivity, right, enhancing productivity in healthcare. And it's not just around how do you reduce waste, but for that same dollar spent, how do we get more out of it? Because there is still so much we fall short on in healthcare. And when you think about that and you think about where we're heading in the scheduling domain, it does make me think that one of the areas is that I think we saw multiple times that scheduling is one system within a whole set of other systems. And therefore, there is an opportunity to influence and improve in many different directions. And so while I think perhaps the team assembled here may be asked organizationally to focus on scheduling systems, there must be parallel teams in the Veterans Administration thinking about optimizing these other areas, and that synergy in between can be a tremendous opportunity. So when we think about divergence and then back into convergence, and very mindful of scope and execution, but that purposeful, mindful aspect of that and making those connections, I think, can be very valuable earlier on in a process. And then the last part I would probably submit is I think while the VA is absolutely a unique enterprise with very unique challenges, I think what you heard even from John's session is that a lot of the challenges facing patients, a veteran, is also facing people all over this country and probably all over the world as well. And so somehow tapping into the collective intelligence of how the rest of the industry is moving forward. And I think you were making this point too of, if Mayo is building something and you can take advantage of it, you want to be able to take advantage rather than re-engineering it yourself. And somehow thinking about collective intelligence in a way to move forward, I think will also be beneficial, particularly with the timeline articulated of 9 to 10 years. I think that would be key.